edition of the LT360 Health Center. That's right, this is one of our podcasts, one of our video series. I'm Coach Scott Oaksfall, and it is a privilege and a pleasure to be with you today. I got Dr. Jay Hitson, not only a beautiful mind, but a great physician and a person that really cares. And I can't wait. I've got a little interview action today with her. I can't wait to get her into this video so that she can, we got an incredible new program that we want to lay out for you guys. And so I've got some questions that I want to get a little interview style with her and let you hear directly from the doctor. But we are glad that you're here. We want to make this available on many different platforms, many different podcasts, videos, audios, so that it's shareable and so that you can have the information so that you can make the best decision for you and your family. So we're going to go ahead and get right into it and get started. Dr. J, welcome to the show.
Oh, thank you, Coach.
I guess this is a showgram, huh? Not program or show, but this is a showgram. Welcome to the showgram, Dr. J. Dr. J, why don't you take us back a little bit? Because I think a lot of people, when they look at the LT360 Health Center, they look at the model that we've created, they look at the vision and the dream that we had a long time ago when we first met. It has changed rapidly over the years, and it's evolved, and healthcare itself is always evolving, but natural healthcare and functional medicine and fully integrated healthcare is really taking a whole life of its own. Why don't you start by just give us a little bit of a state of the union of where the LT360 Health Center is today?
Well, as we've gone through, and we've been really just keep addressing the needs that keep coming to us. And so as we started off, we originally looking at a lot of cellular health and weight loss and nutrition, but then looking at the next level was, okay, but I can't exercise because I'm having these issues. So we started addressing a lot of physical components and, using physical therapy and chiropractic and regenerative medicine. And then we started looking at, okay, well, there's some other depths, other layers to some of the different pain conditions that were keeping people from being able to function and exercise and do the things that they wanted to do. So we've added our neuropathy treatments and our pain care treatments. But one of the things that the need that has kept coming out is a need for a primary care. One point of entry where they could get all the help that they needed.
And one of the things is I've looked at it and why I'm just so impassioned about healthcare and not just treating a symptom, but getting to the core root of why symptoms exist. As I started my own journey years and years ago, and you started your own journey years ago, as our path began to cross, one of the things that really shocked me, and as I looked at the data, starting back in 1984, the CDC, the WHO, NIH, the NAIDI, whatever, and they all had really the same numbers, and that was about 6% of adult population in America was on some type of disease management medication, some type of chronic illness, infectious disease, allergies, some type of long ongoing situation where disease was managed by medication. That number today is almost 60% of adults are on some type of disease management medication. So it's not getting better, it's getting worse. And one of the primary triggers that is when you look at the holistic part of healthcare itself, most of us in the natural healthcare world, in the functional medicine, in caring for others, realize that healthcare is broken. And so we really set out to try to fix some major gaps in healthcare. And one of the exciting things that we've been dealing with and been talking about is the primary care model, but we're going to call it something different. I want you to explain to the folks what exactly this model is going to look like, how it can address disease processes, and most importantly, how it can prevent disease so that you're not caught in that funnel of disease management. And we're going to call it Hopecare.
That's right.
Can you weigh in on that?
Absolutely. So one of the problems that we were running into as we were getting asked this a lot of, they wanted to make LT360, they wanted us to be their primary care. But it wasn't as simple as just, switching people off of medications and putting them on natural things. It goes way, way deeper than that. First of all, we did realize that there's a reason primary care is not working. That system is fundamentally broken. And our mission really has been to find a better way. And there's been a lot of stumbling blocks though. Insurance reimbursement has been a major issue. One of the core fundamental issues with primary care is how insurance reimbursement works. And that's really the thing that has kept so many great physicians I mean, people who really care about their patients haven't been able to do it because of the insurance reimbursement. And fundamentally, the system is a reactive system. The primary care system is reacting to symptomatology, reacting to sickness, and the real solution is really proactive. So when we were initially testing these waters and we were kind of going through, one of the problems we ran into is that patients, we wanted something different, but they kept putting us back into the primary care box. And in the primary care box, where insurance dictates what we do, where there are immense limits on how much time you can spend with your different physicians, whenever there are such constraints, when they kept trying to put us back into the box, we weren't any more effective than anyone else. And so we had to really rethink the entire model. It just wasn't as simple as taking somebody off of their one medication and putting them on something natural. That simply was not enough. And here's basically what we ended up with. First, we had to start with the initial diagnosis. That was number one. In order to really fix this problem, we need to basically get way more in depth. So yes, we've been very thrilled with our exploratory panels. Been so happy with the results and the progress that we've been having getting those. But we also need to get to the physical component. We need to actually do a physical, because there's some things that you just can't diagnose until you get hands-on.
All right, let me stop you right there, because I think it is important to jump in on. When you're talking about an extensive look at a person from a biological perspective, you need just more than a surface level, because the industry and healthcare is based on it pays to treat, not to cure.
Exactly.
So if you're not looking at a curable process, then what you have is an economic model that's built around the pharmaceutical industry, and the doctors are handicapped, the physicians are handcuffed, because now they don't have the time, they can't really diagnose like they should, and they don't really have the tools to have the type of differential diagnosis and also the type of in-depth holistic diagnosis to really find out what is the core root of why the symptoms exist, not just taking care of the symptoms. So what I hear you saying is that this gives us a platform that is really unique in this area, because now we're not just looking at a surface level symptomatology, we're trying to find the actual core root of why the symptoms exist, so that we can have a strategy and a structure to turn this whole thing around.
That is it. And one of the key things that we are running into, the big thing that was missing is the physical component. Yes, getting lots of blood work and all of that. That's I mean, granted, we go to a whole nother level, which is amazing and been fantastic. But then now getting to the physical level, which has been getting very much rushed in the standard, and actually looking at structure, because structure can dictate function. So whenever there are structural issues, well, then we can see functional issues, like for instance in disease processes and how the vital organs work. So we are running up into that, and then the ability to run advanced testing even when the symptoms don't necessarily dictate it. Here's where I'm going with this, Coach. There are people who are listening right now who are saying, but you don't understand my family history. You don't understand the genetic lottery I did not win here. You don't understand my personal history. And yes, even though I don't have those symptoms now, I know to be concerned. Well, you have to understand, in the typical primary care model, I can't run those tests.
Right.
And so we had to completely restructure this, because there's a lot of wisdom in knowing what we're up against. There's a lot of wisdom in prevention. And so that's being able to run that advanced diagnostic testing before the symptoms start was just absolutely huge. And furthermore, the other issue that we ran in, having to rethink the entire model, is the follow-up, the care and education after the diagnosis.
All right, now you're in my wheelhouse, because you've got me excited about that. Just that one sentence alone has the power and the potential to change the whole model of healthcare, because now when you educate people, not just, okay, tell them what they have or what you see and send them off with a pill, but now you have a chance to really invest and plant seeds in them. And one of the things I love that you just said about the educational piece, and I know most of us out there are not microbiologists and pathologists, but what we're trained to look at is how do we not only see the problem and see the issue, which so many people are desperate for because they feel like they haven't been heard and they haven't been seen, but now we're going to actually give you tools to put in your own tool belt so that you can become your own health and wellness expert without having a PhD in microbiology.
And here's one of the factors is you have to have the right team in place. And this is really key, because whenever we're doing this, like for instance, you have to understand that your medical professionals, even some of your holistic professionals, are not trained in nutrition. Yes, they may have took one class, and in general, it's about a 3-hour course that they get in nutrition. And you have to understand that is not enough. So letting the experts be the experts in the area of their expertise.
I love it. I love it. And it's genius the way the model, and it's brilliant how you come up with this whole holistic view that wraps around itself. So it actually feeds itself to help the patient. So now we're not only just physicians, we're not only just PT and chiro and medical doctors and holistic physicians. Now we actually get in the game with the patients and say, now we're patient advocates for you to be your own health and wellness expert.
That is it. And the last, and just where you're going with that, the last step in the process. So one, you have to get better diagnostics. Number two is that you have to equip the patient. But number three, we really do have to change the frame of mind from the onset. We, first of all, needed to work with people who were already looking for this and then willing to make the changes. Because here's the thing, is again, like I was saying before, those who want to get off medications, if you keep doing the same thing you've been doing, you're going to keep getting the same results. So it's not as simple as just removing a medication. There was already a process in place. We need to be reversing that. So for the most part, as we've been going through, we started this process, and at first when we were running up against all these stumbling blocks. Now that we've worked it through and we have this now set, we're ready to launch this. And but the key thing is, if this is going to work, it all starts not only on education once we figure it out, but education on understanding what you're walking into and just working with the right patient.
This is a very important point to make, and this is why we're doing this video. This is one of the reasons that we want to educate you, not just because, okay, yeah, you've been looking for answers and you haven't found the things that you're wanting for. You've been looking for solutions and they've been avoiding you your whole life. One of the things that you spoke about early was a piece that we don't have time to get into, but epigenetics and gene expression.
Yes.
Because there's so many people that say, Doc, look, everybody in my family is obese. Everybody in my family's had type 2 diabetes. Everybody in my family is insulin dependent, or they've had some type of chronic illness or disease. And I'm just, like you said, I didn't hit the DNA lottery, and so therefore I'm not going to be able to live a healthy, whole, happy, full life. We know that that's not true.
That's not true.
But so I want you to set the expectations, because that's going to be very important as people look at us, because we can get very excited about this, knowing the power and the potential it is to change someone's life, change their family, change their genetic line, their bloodline behind them. Yes. But they have to have a level of expectation coming in, because the model is different.
Yes.
And that's very important for people to understand. Give us a little outline, a little narrative about what a patient can expect when they come to the LT360 Health Center.
Absolutely. Well, let's get into, let's go ahead and do a little compare and contrast as to what we had to get away from and then what we're going towards. First of all, when you're looking at primary care, you are looking at nominal and very inexpensive testing that's allowed. All right,
and it's reimbursed.
Yeah, that to be reimbursed with the insurance, and that's why it's so limited. It's because these are the tests that are allowed. Whereas opposed to with Hopecare, we are talking about comprehensive diagnostic testing. When we are looking at primary care, we're talking about medication management. When we're talking about Hopecare, we're actually talking about reducing or eliminating medications. And that's very clear distinction that I want to make sure everybody who comes in has that fundamental goal, either to never get on medication, to reduce what they can, and see what they can eliminate altogether. Otherwise, you might as well just stay in the existing model.
Because if you don't take greater control of your health and get on the front side of it, then ultimately you're not going to live a quality of life anyway. And so it's not, why waste your time?
Exactly.
Right?
That's
so
exactly
when you think about Hopecare, and I love the fact that we've drawn a line between primary care and Hopecare.
Yes.
Can you give us the outline of the actual acronym of Hopecare?
Holistically optimized point of entry.
Beautiful. One more time.
Holistically optimized point of entry.
So as people come in and they're looking to get Hopecare to be a replacement and a completely different mindset.
Yes.
From the old primary care model, which we told you earlier is broken. We know that the healthcare system is broken. As people begin to get into this idea of changing the way they think, changing what they do, changing their habits, their routine, what's the most important thing that they need to know as they get into this type of mindset, this type of model at our health center?
Well, that it is not, every single person is going to do their job. Now, this is including the patient, all right? So
there's some accountability and responsibility on both sides.
Yes, so what we have is we have each person doing their job. So, for instance, we have the medical professionals doing the absolute highest level of what works of the medical profession. We have the holistic professionals doing the highest level of what works in the holistic, and then we have our dietitians, and we have our physical therapists, and we have all of the other credentialed and phenomenal professionals and providers who are all going to do their job to help you get better. And the key thing is that the patient has to be ready. The patient has to be ready to do their part.
All right, everybody, welcome back. This is part 2 of my interview with Dr. Jay Hitson. We're right here in beautiful Murfreesboro, Tennessee at our health center. That's right, the LT360 Health Center. And we have given the listening audience a brand new concept of care, not sick care, but true health care, and we're calling it Hope Care. Hope Care. And so, Dr. Jay, I want you to expand on that vision a little bit, expand on what Hope Care is, and talk a little bit about when someone comes into the LT360 Health Center, and this is their first time, this is their first kind of the entry level of their Hope Care experience, what does that look like?
Well, first of all, they can expect a very intense review of systems. Now, one of the things that we are focusing in on is that we not only need to know what's going on now, what kind of social history, what kind of family history, we need to get an in-depth understanding of who you are and what it is that we're going to be zeroing in on for each individual. So whenever a lot of people who have been through the system, they're like, this is pretty in-depth. It's going to be extremely in-depth on the first side, which is called a review of systems. Then we'll be doing a comprehensive blood panel, testing for every single system and how each system is functioning. Now, everybody will also have opportunities for advanced panels based on their individual concerns or family history or anything else that concerns them that they want to go above and beyond. We will be doing a physical, a full comprehensive physical. Because
old school style.
Old school style. Well, I'll tell you, one of the things is there are certain things that you can only really diagnose until you get hands-on.
Right.
And then of course we'll be checking structure. So we will then be doing screenings for the most common preventable, reversible disease processes. We'll be doing various screening processes for that. Once all that data has been put together, then they can expect that they will sit down with a physician, not the physician's assistant or a mid-level. They will be sitting down with a physician to go over all their findings and create a treatment plan. And then they can pretty much count on, based on those findings, based on what their goals are and what issues we're dealing with, a treatment plan will be put together and will be put to action.
And this is obviously what so many people are looking for.
Yes.
They've been disappointed, they've been misled, they've been defeated somewhat in the healthcare system. And once you get into that disease management funnel, people feel like they're just grinded up and they just don't have any real solutions and real hope. Well, what I hear you saying is this is a whole nother level and a whole brand new concept. This is a novel concept of healthcare. But what I didn't hear you say was that this is like for trauma or for surgery or an urgent care. Expand on that just a little bit so that you can clarify that.
Absolutely. Well, first of all, it's important that everybody understands that the United States of America has the single best trauma care in the world. There is no better place to have an injury or to have an accident than the United States. This will not replace the ER. You still will be going there for all of your urgent needs, and furthermore, using urgent care centers for immediate acute issues. Now we will be getting into some of the differences and how we'll be able to, how patients can expect to use us. But in general, we are going to be focusing on prevention and working with especially chronic conditions.
Now, I want to just touch that just a little bit because there's a question that's obviously looming in most people's mind as they listen to this, as they watch this, because again, we have been conditioned from an economic standpoint of how our healthcare systems work. I think the looming question would be, okay, I'm interested, I'm in, this is what I've been looking for, how much is it going to cost?
Absolutely. Well, first of all, one of the wonderful things is that everything in LT360 Health Center is HSA and FSA eligible. So all expenses can be put through that. But the initial comprehensive workup, the full physical, all the diagnostics, all the screening process, everything, and including the time and treatment plan with your physician, it's $675. Now, we're pretty proud of that.
$675
Yes.
to get all of that, including the expertise, including the like you said, the treatments, the strategies, the structure, hands-on with a physician, and really a plan moving forward so that you can be all that you were created to be and live your best life. That really doesn't seem like much at all. So how does that model work?
Absolutely. Well, here's the fundamental thing. It really stems on prevention. See, that's how we keep healthcare costs down. It's through, the best way to solve a problem is to never have it. And so we're going to be able to keep that down. Well, let me say, first of all, we really want to zero in on prevention because prevention is about true quality of life, number one.
And by the way, you can't put a price tag on that, no matter how much money you have.
Exactly. And then, but number two, this model really is the solution to the rising healthcare costs in America. It is healthcare costs are inevitably going to bankrupt this nation if something doesn't happen. And the answer is preventing these costly chronic conditions. And really the bigger mission here is to prove, demonstrate, and refine a healthcare model that frankly the American public is already demanding.
Right. And we've talked about this before off air, and the type of research that I've done and the data that's been pulled out. About 2 years ago, the data showed that probably somewhere around 2050, we were going to be bankrupt if we didn't change that. Well, that brand new data that I just looked at has now been moved up to 2033 is the next projected date that's possible for some type of catastrophic economic event.
Yes.
And this is why we still have time.
Yes.
We still have time to turn this around. We still have time to get people healthy. And we still have time to really get people thinking differently because this is cyclical, but it's also transferable. So when you encourage somebody, when you help somebody, when you educate somebody how to get healthy and stay healthy, that normally doesn't just stay in that one seed. It comes out on all types of limbs of the tree, which is your family tree and the people that you love and care about, and that's most important.
And one of the factors that we are running into as we're working and refining this model, annual checkups
Yes.
are going to be critical here because we have to continue to early detection. We have to prevent these disease processes from ever happening. And that, and essentially, not only will that lower costs, but it's going to increase our outcomes fundamentally. Right. Now, of course, there's going to be costs associated, but that's nothing compared to the cost of getting sick. That's nothing compared to the inevitable cost. And I know we're talking on a personal scale, but we are, in a very real talking about on a national scale. This is what has to happen.
And most people already know that. I mean, all you have to do is spend one night in the hospital and look at your bill, and you can see how expensive it is to be sick.
Yes.
It's very cost effective to be healthy.
Yes.
And that's the whole goal, is to get you healthy so that you can become a conduit of change. Not only it starts with you, but it also is going to really, really spread like wildfire to the people that you love and care about most. And one other thing I might add, so because we did talk about specifically that we're not urgent care, okay? But somehow somebody is going to inevitably ask this question, if you're not already thinking about this question right now. Well, if you're not urgent care, but you are a Hope Care and it's a primary care model, can LT360 Health Center now become my PCP?
That's a great question. And for those whose health fits into our scope of practice, yes, on your forms, and that's the one thing that a lot of people are thinking about. Every time I fill out these forms, they want to know who's your PCP. And a lot of the individuals who we're talking to and who we've been talking to, they don't even have that right now. So they want to be able to, this is the person I go to, this is my point of entry. So yes, if you fit within our scope of practice, if you fit within the scope of healthcare, yes, LT360 Health Center can be listed as your PCP.
Well, let's close with this question. And again, I think that you can obviously see that Dr. J has a wealth of knowledge, and this plan that we put together and come up with is not just something we just thought about, 2 years ago. We dreamed about having an opportunity to help people like this, but really as it's evolved, it's become very clear what the next steps are so that we can truly become the patient advocates that I think we're really called to be. So as you think about as people think about this and they just know it without a shadow of, this is where I want to be a part of. What is the next step? How do they get enrolled? How do they get involved in the LT360 healthcare Hope model?
Well, first of all, you can go to our website and you can you can reach us via the website, or you can just reach us by calling 615-610-6937. That's 615-610-6937, and let the staff know that you're interested in Hope Care, and they'll get you all the information and they will get you started in the process. I will say there's been a very high demand. We have an extensive waiting list already that's been formed for this particular program. It's taken us longer than we anticipated, hasn't it, Coach?
Yes.
To get this together, and go figure. I mean, if this was easy to solve, it would have been solved a long time ago. It's taken some very innovative, a lot of innovation, not only on our part, but also our amazing team,
And speaking of our team, it's probably one of the things I'm most proud of.
Yes.
Because I'm so excited that we have so much scope of practice here, all under one roof. And so many people have said, Coach, this is a dream come true for our personal health care and our family's health care, because everything's under one roof.
Yes.
So we have primary care physicians, we have our medical doctors, we have holistic physicians, we have DCs, we have physical therapists, we have nutritionists, we have IV therapy, we have nurse practitioner, we have coaches. I mean, it's just amazing, and our support staff is incredible. Give a shout out to Mr. John Fleet right over here off camera right now, putting this video together for us as our producer. But I want to thank you, number one, for all the effort and energy, because when people roll this out, what they won't see is all of the countless hours and paying attention to the detail with really one goal in mind. And this needs to be said. The goal is there's not some kind of pot of gold at the end of the rainbow for you with this, because I know your heart. This is about people. And when you put people first, people over policies, people over procedures, when you always put the best interests of people first, amazing things begin to happen. And so I thank you for that. I thank you for putting this team together. I am so grateful to be a part of it. And so again, if you are interested in the Hope Care model, I want to do not hesitate. You've got to get in that, you've got to get in line, you've got to get in that system. And the best thing to do, like she said, pick up the phone, give us a call, get online at LT360.com. And our staff will be more than glad to help you get in line so that you can be all that you were created to be. We're grateful to have you. Thanks for coming on today. John, thank you for producing the show. And we will see you again soon. LT360.com. Take care, you guys.